I'm really, really happy to introduce to you today California State Senator Edward Paul Ed Hernandez. He represents the 22nd Senate District, a member of the Democratic Party, and he is the chair of the Senate Committee on Health for the California State Senate. Ladies and gentlemen, without further ado, Senator Ed Hernandez. Thank you.
Well, good morning. Thank you very much for the introduction. And first of all, let me welcome everyone to Sacramento. I just kind of follow up on the speaker before me. It is really important that you advocate for what you believe in, but more importantly, to kind of express your concerns and your support for various issues there here in the Capitol. I was asked to kind of talk a little bit about health care here in California. And as chair of the Senate Health Committee, I want to kind of give you a very, very brief overview of what we've done in California, where we are with healthcare, kind of where I think it's going, but more importantly, how you are going to play an integral, important role in it. So if you think about what we've done here, California is the first state to have an exchange shortly after the implementation of the Affordable Care Act. But not only were we the first state to have an exchange, we have been taking a leadership role in its implementation. As chair of the Senate Health Committee, I've been able to introduce the 10 essential health benefits, which we were the first state to actually define habilitative and rehabilitative services. All of the consumer protections that are afforded to us, we've implemented. Probably one of my more exciting pieces of legislation that I was able to introduce was the Medicaid expansion that the governor signed several years ago, where 1/3 of the state is on Medicaid. When we look at the exchange as it's now, I believe, in its third year moving forward, I speak to Peter Lee on a regular basis, and we are just signing individuals up in large numbers compared to the rest of the country. We are just light years ahead when it comes to the Affordable Care Act. But here's what's interesting. There was a comment made about the presidential election. As we know, the Affordable Care Act has always been very controversial. The Supreme Court found it constitutional. But I really believe that what California has done and what the consumer is now seeing in what the services that they're getting through health care, where no one's denied by having a pre-existing condition. We now know that no one can go bankrupt because of the cap on the amount of money they're going to pay out. The subsidies that are given by the federal government, the Medicaid expansion. More and more consumers throughout the country are realizing how important this is, and I think it's going to be very difficult to kind of move backwards. I'm very partisan. I hope the Republicans don't control, obviously, the presidency, but I really believe that this is a policy that needs to continue to move forward. So let's talk a little bit about some of the barriers, but not more importantly about some of the changes that have occurred, and then kind of get into the importance of telehealth and what you guys are doing here and the message that you're going to be advocating across the street at the Capitol. So post-Affordable Care Act, we as individuals are creatures of habit, and nobody is used to or likes change. So there was a lot of uncertainty. And it's uncertainty from all aspects of healthcare, from providers to hospitals to plans. I mean, you name it. Lots of uncertainty. Shortly after that, you're starting to see the market starting to change. A lot of consolidations. Consolidations we have never seen like it before in the healthcare system. You've seen health plans purchasing other health plans. Because of Medicaid expansion, just think about the budget in the state of California for Medicaid alone is $94 billion. You have Blue Shield buying up CareMore. You have Centene buying up HealthNet to get into the Medicaid market. You're seeing hospital consolidations. You're seeing large medical groups starting to form. You're starting to see IPAs form in larger numbers. So, and you're seeing this because most of these groups to be competitive need scale. Okay. So where is healthcare going? And because of all this consolidation, well, yes, reimbursement rates are starting to get lower. Yes, Medi-Cal reimbursement rates are the worst in the country. But I think in order for us to continue to move forward and be successful, we have a couple of challenges. The first challenge is here in California in particular, also across the country, we're starting to see that we have a lack of providers. We have problems with access. We have problems with distribution. And we have two areas of concern that have these particular problems. That's the rural and the inner city communities. Okay, that's one problem. The other dilemma that we have to deal with is the cost containment and cost control of healthcare. Because the number one concern by the consumer is what they're going to be paying for their premium. So government is going to be very mindful of that. So the reality of healthcare, what's going to happen, providers are going to have to see more patients, be more efficient, be held accountable, and have better outcomes, and guess what? At a lower price point. So this is where telehealth, where telecommunication, but more importantly, if you look at what the federal government is doing with phasing in with meaningful use, how we're going to go into electronic medical records, this is all going to be part of how we're going to have a much better integrated system. But as I was mentioning to you in my earlier comments, how we are creatures of habit. And I can tell you, providers, hospital groups, it's very difficult for individuals to make change. And I think where a lot of that frustration is going to come from is the provider groups that are the much older provider who doesn't have that comfort level to move into an electronic medical record system. I see some of you shaking your heads up and down. And it's usually that provider that's between 55 and 60 years old that says, you know what? I don't care. I'll take my, 10% they get reduced in Medicare or whatever that, 3%? I'll just take my 3% cut. I don't want to deal with this dumb iPad or the internet, whatever this social media stuff is, and they're just going to retire out. So that's going to be the difficult thing. But I'll tell you, as difficult as it is, and yes, there's some money that's being supplemented by the federal government, to help implement this, but it is going to make health IT, but more importantly, healthcare a lot more accessible as we start to create communities. But also, I think what really needs to be done, I think I heard a little bit on the last presenter, is we really need to find out how we can be more efficient in telehealth. I've carried several bills, especially dealing with eye care. I'm carrying a bill currently right now for Planned Parenthood to use an app to do some telehealth. But let me tell you why I think telehealth is going to be extremely important. There's two areas that I mentioned that we're having an access problem and a distribution problem, and that's the rural communities as well as the inner city. Well, I also mentioned that we passed a law to define the 10 essential health medical benefits. One of those benefits is mental health. Well, guess what? We are going to have a very difficult time finding mental health providers. First of all, you have very few psychiatrists that are now even taking any insurance. They're gravitating towards the private pay, taking cash only. So forget the Medicaid population. It's going to be even more difficult. We need to look at innovative ways how we're going to use telehealth for mental health. How we're going to use telehealth to do retina images in Fresno, to have an optometrist or an ophthalmologist at UC Berkeley look at it. How are we going to use technology to be more efficient in our healthcare system? This is how I see we're going to need to move forward. And yes, there's going to be a lot of pushback from providers because of the uncertainty and the change that's occurring. But I really believe that the industry that you represent, but more importantly, what you're advocating is a very, very important part of as we move forward in the implementation of the Affordable Care Act and healthcare in general. So I was asked to just make a few brief comments, 3 to 5 minutes. I think I've reached that limit. What's that?
You're fine.
Okay. Well, I'll tell you what, if I'm okay for a little bit further time, what I'd really like to do is open it up to any questions. Tell you, being chair of the Senate Health Committee since I got in the Senate, I kind of feel like I'm a kid in a candy store because I literally have been involved with every single healthcare issue dealing with in the state of California and kind of putting California in the forefront of its implementation. It's been some really fun things I've been able to work on. I'll just very quickly share with you. Just not too long ago, the governor signed into law my smoking to 21. So as of June of this year, I think it's June 9th, no one can purchase tobacco. Yes, come on, you guys need to clap. Superior 21, and right now we're working on some transparency issues to control drug costs. Three of my areas of concern, obviously, is the successful implementation of the Affordable Care Act, access to care, but the third one is controlling healthcare costs. And we're doing a drug transparency bill, which we're getting a lot of pushback from pharma, but I'm committed to moving that forward. So with that, why don't we open it up to some questions? Anything you have on any issue related to healthcare?